Hello, good afternoon and welcome everybody. It's so nice to see a room full of faces. My muscle memory, I have to confess, hasn't kicked in yet. It's been a long time since I've stood on a stage and spoken about health and wellbeing. Of course, we've done a lot virtually, but haven't done it on stage for a while. So I just reflect on my own journey through lockdown and the pandemic so far. And I was very much one of those people who was working in the office pretty much full time before the pandemic. And I now find myself looking at a hybrid working environment going forwards. And I'm currently transitioning between that working from home and going back to the office. And I've been reflecting on the types of things that I found as positives during that period and the things that I found as negatives. So I want to share with you the findings of a survey that we've done and a report that we've published in conjunction with the Royal Society of Arts. And it also touches on some of the findings from Britain's Healthiest Workplaces survey that we run. Don't worry about writing down the loads of stats. I have got loads for you. But we do have copies of a summary of the report on our stand, so you don't need to scribble them all down whilst I'm talking. Okay, let's get going. So we know that many people and home workers during the pandemic have found health and well-being being even more important to them in how they consider their careers and their roles going forwards. And we know it's really important as well from an employer perspective to take this into account. And one of the reasons for doing that is because we know that when health and well-being is discussed and visible at board level, actually we see a higher participation in health and well-being overall within the organisation. As well as being visible at board level, we know also that there's much greater participation in health and well-being by the employees when information is shared back with them about the take-up of particular types of health and wellbeing initiatives, the findings from any particular surveys that you're doing. So again, it's really important to share that information back with employees. And there's been lots of surveys, I'm sure you've done some throughout lockdown and the pandemic, about how employees are feeling about returning to the office. We know that, I'm sure we've all found it, working from home and working remotely has led to increased strain and musculoskeletal issues, caused in part by people setting up home office environments that may be not suitable, that maybe present themselves with additional risks in how they're seated, not seated correctly. We all know people who have been sat on their beds with their laptops, sat at dining tables and less than ideal circumstances. And as well as not necessarily being situated properly, remote workers we've seen have had much of their time that maybe they would have used commuting converted into actually additional hours sat in front of a screen and sedentary. So even before the pandemic, on average, office workers were spending 9 hours a day seated. And obviously the home office environment and home remote working has increased that. So the stat here around 3 extra hours, and I know from my own perspective that I had an hour each way commute, so that's probably at least 2 hours a day for me. And I think although 3 hours is the average, we know that many employees are doing far longer days. So remote workers are turning to physiotherapy, absolutely, but many of them are also turning to painkillers. And so we've got to look at what other things can we do as employers to support our population from turning to those painkillers. One of the options and one of the things that will improve musculoskeletal health is physical activity. And despite the potential availability of being able to do that physical activity at home, actually we see that people have overall reduced the amount of physical activity that they've been doing throughout the pandemic. This is despite them reporting that they've actually got more time to undertake those levels of physical activity and more time to get out and about. So why aren't they doing it? Many employees report the fact that their employer isn't giving them the time in the working day to undertake those levels of physical activity, or indeed just get out and about, get out for a walk, get up from their desk, maybe practice some mindfulness techniques that would support not just their physical well-being, but as well their mental health as well. So a big majority, as you can see here, of people actually found that remote working enabled them to better manage their mental and physical well-being. And that's largely, of course, because they can do what's right for them, the method that's right for them, the time that's right for them. And they're not dictated by what's available at the office, what is provided to them within the constructs of their environment. So there are many positives from remote working, but we do see overall that many people are concerned about the return to office and the impact it will have on their lifestyle. I'd imagine some people in this room would have got dogs. Lots of people I know have got puppies and gone out and found new ways of operating at home. The remote working has given them the opportunity to spend more time with family members, people with young families maybe, and caregivers as well have maybe found better ways of supporting and had more time available to complete those duties. But it's not one size fits all. And that's what's critical to consider, is the pandemic has affected people in different ways. And whilst a lot of people will have found remote working a very positive experience, there are particular groups called out in our report that have had a more significant negative impact from remote working, and those things need to be considered going forwards by employers when they're looking at return to the workplace. Women in particular, home workers, have felt more anxious than their male counterparts in considering the return to the workplace. So if you give everybody the flexibility to choose a completely open choice of whether they go back into the office, you may find that you get more men returning than women. And this could cause further problems down the line around diversity and inclusion. It could lead to other impacts on pay and progression, which I'll come to later. So that's got to be factored into the thinking when thinking about a hybrid solution. Young workers as well, of course, have been impacted, and they report a much more significant feeling of isolation and feeling remote from their colleagues and peers. So for them, largely it might be a positive experience coming back into the workplace as they feel more socially connected to people. They can benefit from the experience of their peers, the team environment that they're in, and I think they found particularly the isolation very difficult. As well as that, a number of them, again, a large proportion, don't necessarily have that isolated space for home and remote working that many others do. So it could be that they're still sharing a house with their parents. I know that's people live longer and longer at home these days. It could be that they're sharing a room in a rented accommodation. So again, they're less likely to have that space at home for remote working. So if you're considering a model that has people staying at home, that really needs to be factored in around the impact on young people. And we know as well that people from a BAME background in the survey reported more significantly than actually white employees that they were working harder. They felt they were working harder during the remote working pandemic. And that's not necessarily a negative thing, because they also reported, and BAME females in particular reported, they were more significantly struggling to cope with the extra demands and pressures that were put upon them. So working harder in this context was not a good thing necessarily, but actually a negative thing for them. So we've all seen this picture probably, and images like this on our virtual Teams calls and Zoom calls, and people have many impacts of having the children at home, lockdown schooling, etc. So mothers in particular found the impact of that affected their productivity more significantly than fathers in exactly the same position. And that's been well reported, I think, in the media, the impact on women. A third of women report worse concentration, again, more than men. The impact, I think, of all of those things that we described, childcare, additional home responsibilities, additional care and responsibilities, has been one of the things that has made them feel that there's been some negative outcome of working from home. Okay, so what do we do as employers then when considering the return to work and creating a sustainable and inclusive hybrid culture? So the report that we've got on the desk shares some top 10 recommendations. So I'll just go through those with you now. 1, reset the level of expectation. So COVID has inevitably changed the current state of work and future of work forevermore. And employees were well served often by employers when we went into lockdown. And their expectations have changed. Employees, when asked, only 16% of them wanted to return full-time to the office. So a vast majority either wanted to return part-time or not at all. When you consider the expectation of those employees, actually, even though only 16% wanted to return to the office full-time, a third of them thought that they would be expected to do so. So employer needs to set out their expectations and mandates and communicate that to the employees as quickly as possible so that that gap between what they think they're going to be expected to do and what they'd like to do can be closed as soon as possible. And get it on the risk register that low employee health and well-being is actually as significant a risk to productivity and ultimately bottom line and profitability for an organisation as some of the other economic risks that have been caused by COVID. Senior leaders need to lead from the front and practice what they preach here. So in taking on board the health and wellbeing initiatives, they need to signpost, they need to demonstrate that they buy into these mechanisms, these new policies, procedures and mandates that they're setting out. They need to signpost what normal looks like so that employees are more likely to change their behaviour. We know, I think there's been several studies done, but in particular an example of an organisation where the CEO wanted to test this theory and had a conference like this and got up on stage without socks on, clear gap between his trousers and his shoes. And lo and behold, after that management conference, more and more people started turning up for work without those socks on because they're emulating, they're copying, and they're seeing, well, that's normal, so I should be doing that. So again, leaders need to lead from the front here. Not be sending emails outside of working hours, not undertaking the activity that they know is not necessarily what they want their staff to do. The feedback loops. I think at the start of lockdown, employers did a great job of pulling employee forums together, getting groups of employees to discuss the issues, the challenges, and they use this for their crisis management planning. What the report is calling for is to let's not stop doing that. That needs to continue. It's going to be a bumpy ride as employers start asking people to come back to the workplace. So they really need to think about how they continue those feedback loops. Productivity gains as a result of hybrid, indeed remote working, again, need to factor in people, particularly working mothers, caregivers, those from a BAME background. And focus on, employers can focus on outcomes rather than how many hours a day somebody is logged in. And that's particularly something that employees are looking for in terms of flexibility moving forwards. Breaks. We used to, in the workplace, have natural breaks. We used to walk between meeting rooms, get up and have a chat by the drinks machine, go up and grab your lunch and see people. Those natural breaks that break up our concentration, allow us to refocus, are not necessarily evident when people are working from home. And so the report actually suggests mandatory 5-minute breaks. Only make meetings 55 minutes long. Take breaks within the hour. I know it can be hard to do, but it is calling for breaks to prevent burnout. I think we've all done the back-to-back Zoom calls all day, every day. And if that's going to continue in the long term, that is going to burn people out. Policies. So new health and wellbeing policies and mandates. Employees are looking more and more for policies and plans that give them the flexibility and the support that they need going forwards. menopause support services, parental support services, health insurance, virtual GP services, things that are going to give them the things that they need, not things that attract them into the office and spending more time at the office. So policies and health insurance and PEPI, our menopause support provider, is included within our plans. Things like that are what employees are looking for: financial well-being, support, etc., not table tennis tables and necessarily on-site services. 30-minute breaks. Hard to do, I know, to put into everybody's working day, but people need a break from sitting all day, particularly if they're working from home. Professor Chris Whitty advocates for 150 minutes of activity every week, so 30 minutes every day. Now, this can be employer provided through their health or well-being programs, HIIT sessions, yoga sessions, mindfulness sessions, something to pull people away from their desks, their chairs, their seated positions, and get them active and moving again. Measuring. It sounds obvious, but you get what you measure. And employers can really start to measure leaders as well as their staff on how they're participating in health and well-being, how they're feeling about health and well-being, which services are they using, which services are they not. Does that make a difference? And that can be integrated to things like Microsoft Analytics. There's loads of new types of software out there that we're using as an organisation to combine with the other wellbeing data that we have. The Vitality Health and Wellbeing Programme has a huge amount of MI that employers can use to really monitor and see what benefits and what's being used. Okay, accountability. All of this is great, but what we're calling for in the report is that really you need one person within the organisation, ideally at a senior leadership level, who's accountable for taking all of this, looking at all of the MI, looking at the change and the benefits over time, working hand in hand with the CEO about how they bring all of these things into the policy and procedures within the organisation. So we're calling for a head of health and wellbeing in each organisation to drive and monitor all the things that need to be done as we return to the workforce. The publishing of that data, that information across the organisation, I think is critical. And as I said before, leaders can increasingly be asked not just to focus on the metrics that, of outcome and output of their organisation and their team, but also the health and wellbeing of their staff. How are they encouraging their staff? What's the take-up of health and wellbeing? How are their team performing in different ways? And I don't know if you've come across this phrase, digital disadvantage, but a lot of the leaders that we spoke to and interviewed were particularly concerned about this digital disadvantage. And those employees who continue to work remotely, not being part of the conversations in the office, not socialising, not being seen, not being visible. And as we referenced earlier, that's particularly important for some of those demographic groups that I referenced: caregivers, females, people from a BAME background. So monitoring pay and progression based on those demographic groups, not just overall, is something we think is critical moving forwards. Okay, I've shared a lot of statistics with you. As I say, the report is available on our stand. Vitality, as you can imagine, has a number of ways that we think we can support employers around solutions to returning to the work and a healthy hybrid environment. Thank you very much.